Vaccinations at the clubhouse were given to healthcare workers for the county. Think first responders like paramedics.
They come in, they get a validation, they get some education on the vaccine, the side effects of it, et cetera, the emergency use authorization for the vaccine. Then they receive the vaccine and they have an observation period afterwards just to make sure that they have no reaction.
Guilford County Emergency Services Director Jim Albright knows the process because he went through it early after the vaccine arrived last week. He says other than a day with a sore arm, he's had no other side effects. He says it's hard to know how many county employees they'll vaccinate under Phase 1.
The vaccine is not mandated for any of our employees. It is highly recommended. We certainly would like to see somewhere in the neighborhood of at least 2/3 of our staff taking the vaccine.
He says there are some employees who have a wait-and-see attitude towards getting the vaccine. Albright says getting the vaccine early was in part about making sure the process was efficient and also in the hopes of making people feel more comfortable.
A lot of people have a lot of angst about the vaccine, and we hope that because those of us in leadership are getting the vaccine early, that our employees will follow.
Today's clinic ran for a couple of hours this afternoon, but he says the hope is to be running full-day vaccination clinics by next week. I also asked him about the timeline for Phase 1A and who might get the vaccine next. I'll explain more about that process coming up at 6.